If there was any other time in my life where I would experience something that's close to ADHD, it would be this. Starting off as a new nurse is brutal. Hey guys, welcome back to the channel. In today's video, I'm going to be spilling the tea for y'all. I'm going to be giving y'all my review of nursing after a year. I'm going to be talking about what the job actually looks like, what it actually feels like to be a nurse. I'm going to be spilling the tea on pay, if we actually are living a luxurious lifestyle, or if it's really just all talk. The scheduling and just how to manage it and balance your career life and your social life. So if you want to learn more about nursing and also just hear about my experience of being a nurse for over a year, then this video is for you. So let's get into some things. Let's get into the tea, y'all. I'm ready to spill the beans. On my channel, y'all have kind of been with me throughout my nursing journey. We started when I was still in nursing school, my senior year, and I was vlogging like my clinical experiences. And then last year, or 2 years ago now actually, I recorded my journey with the NCLEX. The struggle of trying to complete that last step to get into my actual nursing career. And now we're recording me over a year later in my nursing career. That's just crazy to think about, but I am excited and happy to be recording this because of that reason. So let's talk a little bit about where I am currently in my nursing journey. I have been a nurse for over a year and a half now. I'm closer to my second year than I am to my first year. Once you have the title of a nurse, that means you completed whatever nursing degree that you got, whether it's your associate's, your bachelor's, or an accelerated program degree. Whatever it is, you just have your degree in nursing and then you also pass your NCLEX. So we're going to take it back to what I was like at that stage. I had already applied to some nurse residency programs. Let's start off with talking about that thing first. I highly recommend, or not even recommend, I urge you all to do a nurse residency for your first job as a nurse. That's if you're doing bedside inpatient jobs. So there's also two different types of nurses that you can be. You can either be an inpatient nurse or outpatient nurse, and I am an inpatient nurse. So I have over a year and a half of experience in the hospital working on the unit. In that first year, you really need to feel supported and educated through all the new skills that you're learning, because it's critical. This is no longer a simulation. This is you actually interfacing with other people's lives and affecting them in whatever ways you do. I really recommend a residency program because they offer you education classes, they check on you regularly and make sure that you're on the path that you need to be on. In conjunction with applying to a residency program, I also suggest that you know which specialty you want to go into. Hope is that you would have had experience in nursing school and on your clinical rotations. If you didn't have that experience, I would think about what style of nursing you want to do. If you want to be really hands-on and critical, then think ICU. If you want to be more broad, then think of like med surg. But there's just many different specialties, many different units that you can start off on. If you weren't able to get that experience in nursing school, then just do your own research and figure out what specialty or what field feels like it's best for you. For me personally, I knew that I wanted to be in the NICU, the critical hands-on that I can have, and then I like my patient population. I like working with babies. I did not want to work with adults or really children. I just knew that the NICU was for me, so that's what I did. This was even before I became a nurse. Honestly, if there are like magnet hospitals, if they're like teaching hospitals, and I'm pretty sure all of them should have a nurse residency program. I basically just applied to all the magnet hospitals in every city that I wanted to be in, like DC, Chicago. I applied in Texas, LA. I made sure I specified that I wanted to be in the NICU, because sometimes they'll have residency programs where they'll just put you wherever they need numbers or wherever they feel like you might fit. But I was like, I'm letting y'all know this now. I know where I want to be and I'm not going anywhere else. So if a residency program didn't have any NICU spots available, or if they just, weren't trying to get me in there, then I took them off my list. Like, I knew what I wanted and I knew that I had options, okay? That's the other thing to know also, just to let y'all know about nursing in general. I feel like we know that the hospital needs us more than we need them. So When I was applying for all these jobs, that's the mindset that I had. And if they didn't give me what I feel like I needed and wanted plus more, then long story short, I got into one of the residency programs that I liked. Started as a NICU nurse right after graduating. This is my first nursing job. So let me tell you guys what it really looked like when I was a new nurse, and then when I actually could be comfortable, and then where I am now. Going back to how I was as a new nurse. Okay, as a new nurse, you don't know anything at all. I don't care if you made straight A's in nursing school, if you pass all your exams with flying colors. Once you get on the actual unit and you're practicing as a registered nurse, you don't know what it means for someone to tell you to do this procedure. You don't know what it means for someone to tell you to do like a head to toe assessment. You may know what normal things look like and what to look for, but the unit specific way of doing things, you're not going to learn until you're actually on that unit and you're working with a preceptor and they're showing you how to do things. Starting off as a new nurse is brutal. I'm just gonna be honest, it definitely is not easy, okay? It feels like, I can't even describe what it feels like because it's nothing that you experience as a nursing student. It's something that you have to learn and have to get through as a new nurse. Since I'm in the NICU and I'm an ICU nurse, we see patients that are on ventilators. Ventilator is basically an advanced form of respiratory support, and these patients need suctioning. Yes, I learned about suctioning and sterility in nursing school, but the actual skill of suctioning, doing inline suctioning for a patient, why is that like one of the hardest things I had to learn? That definitely took me a good 3 months to learn how to do and be comfortable with. Luckily, my preceptors were very knowledgeable. Like, they were experienced nurses, top of the line. They gave me some real ones, and I still appreciate them to this day. I lucked out and I was able to have and work with amazing preceptors, but sometimes, especially being a Black nurse, they are still very much racist and do terrible things. I have definitely heard horror stories of people having bad experience with preceptors, people trying to sabotage them and be weird, the culture just being uninviting. Thank God I didn't have to experience that, but I have heard of it, and my advice would be to always advocate for yourself, especially once you're a new nurse. I had to advocate for myself even though I didn't go through those experiences. Yes, they want you to be a safe nurse on their unit. That's why you're getting precepted in the first place. But sometimes people don't really care about you specifically. They'll just let whatever happen, and then if stuff hits the fan, they will blame you. So really make sure you advocate for yourself, that you got your back covered. Just know that you're there to learn, and once you make it through that period of learning, you don't have to deal with anybody anymore, because you're going to be in your own autonomy and in your own nursing practice. You do have to integrate with the other nurses around you and support each other, but at the end of the day, when you're working as a nurse by yourself, that is your care, right? Those are your patients. Nobody else can interfere with that unless you're doing something unsafe. So yes, it's hard to deal with crazy preceptors, racist preceptors, but advocate for switching to somebody else and just get through that period, because once you're done with the precepting and orientation, then you're on your own and you can tell them what your work is really like. They will see once you're on your own how you really are as a nurse. At the end of the day, you know yourself the best. If you really are doing what you're supposed to be doing, don't worry about them at all. I know it can get crazy in the workplace with nursing culture especially, and precepting. I don't know why people are so weird. It doesn't make sense to me, but you just gotta get through it. You really do learn and grow so much in such a short amount of time. Just looking back on that period, I did not know anything. And nobody does. That's something that I really had to learn. I'm not going to know everything. Some things are just going to take time. I just remember where I was in that moment and feeling like you don't know things. There is not a way to make it happen quicker. It brought me so much anxiety coming into work, and sometimes I really felt like I don't know if I can do this. I don't know if I can make it. You really just have to push through and continue to think about the light at the end of the tunnel, which is you'll be able to come out being a competent nurse if you just continue to show up and learn every day. Just take it day by day, learn what you can in that day, remember it, and then use it for your next day. Something else that really caught me off guard starting off as a new nurse is the schedule. Let's talk about that. So nurses only work 3 days a week. Each of our 3 shifts per week are 12 hours each. I don't know how many of you have already experienced that. I'm sure if you're watching this, then maybe you're a nursing student or somewhere in that field. But we're basically working a 40-hour work week in half the amount of the week. I did work in the hospital before, so I had worked like 2 12-hour shifts. Like that was the most that I did as a nursing student. I know it may seem dramatic, but adding on that extra day is serious. It really does make a difference. It's just really heavy at first if you aren't accustomed to it. The other part about it is switching between days and nights. We're gonna get into it, okay? We're really gonna get into it. Let me tell y'all. In my residency program, they had a switch from days to nights. It was every 6 weeks, to say the least. I was really messed up. First year nursing was hard. Between the schedule, between feeling like I don't know anything. Also, let's talk about the pay. I'm gonna talk about the pay a little bit later, but let me get into this scheduling first. Like I told you guys already, we're working 3 12-hour shifts a week. For the first year of nursing, I had to work every other weekend. I had to flip back between day and night. Our day shift is 7 a.m. to 7 p.m. and then night shift is 7 p.m. to 7 a.m. Just saying that in itself, I hope you guys can understand how all of these things combined together can really overwhelm you and bring so much anxiety. So during an actual 12-hour shift, I can get into that into another video because that would be a lot in itself, but just know that it's very overstimulating. Wear so many different hats as a nurse, and if somebody isn't doing their job, you have to do their job as well as your job. And then you have people asking you questions and having different demands. You just need to be aware of how all of these different factors can build up and be a lot on one person. Nurses are just people. I really do love my job and what I do, but some days I feel like I really am expected to be a superhero or something because the demands and the tasks and things that I have to do on an hour basis, even a minute basis sometimes at work, is just a lot. First couple months, I felt like I didn't know anything. I struggling with the adjustments in the schedule of working full-time 3 times a week, 12 hours per shift, and just dealing with all the demands that came with the shift. But like I said, luckily I was in a residency program, and first couple months of that we were taking classes, so we would have some time on unit and some time off unit to take our classes and kind of go over broad general information that we would need to know. That was very helpful, but yeah, first couple months was whew. So the next stage of my first year in nursing was my new nurse stage. The first stage is like novice baby nurse, where you're literally just straight out of nursing school. You're like, oh, you don't know nothing. You're pretty much just following your preceptor around. Now I think back to my preceptors, it felt like mom to me. I'm just like, wait, mom, help. Literally, I feel like you cannot do anything by yourself without your preceptor there next to you. These things are just like scary. They're new. It's a new environment. Then comes a period where you have a foundation of how skills are performed on the unit, how your assessments are done. Like you feel a little bit more comfortable, but you're still with the preceptor. I call this stage being like a new nurse. Definitely have a lot more independence. Your preceptor is more so taking a step back and just allowing you to do pretty much everything and just monitoring you more so. The anxiety is still there. Overwhelming feeling, this nervousness of going into work and not knowing what to expect, what patients you might have to get, what you would be expected to know for that day. But start to develop more ease with uncertainty. And I think that's the most important thing that you should understand when you're a new nurse, is to be comfortable with being uncomfortable. I always go into things feeling like I have to know everything in order to feel safe, but nursing really taught me like, you don't need to know everything and you're not going to know everything. It's okay. It truly is okay if you don't know everything. Most important thing is you have to know how to figure it out if you don't know something. If I've seen something for the first time, my first time getting a patient back from post-op and not knowing what the protocol is to take care of them, that's something I would suggest in this stage is to make sure you know your hospital protocols and their procedures. Second line is to just ask questions. There's plenty of experienced nurses around you. They know the answer to what you're asking. Pretty sure they've been through the same thing. So it's really just asking them whatever question you have. After, I feel like you try to figure out on your own by looking at the standardized policies and procedures that your hospital already has. Like towards the end of this stage, once I realized that, I started to be a little bit more comfortable with coming into work and doing my job. It still was very anxiety provoking because sometimes I would just see things that I never seen before and I'm like, oh my gosh, like if it's parents there also, it's hard because I have to explain to them things that I don't even know what I'm talking about. I feel like in this middle stage of nursing, it's really like a middle stage. It feels like you're not as new as when you first came out of nursing school, when you first started, but you're still not at the point where you feel like you could just walk into any situation and handle it even if you don't know everything. I really don't know what is worse. I don't know if starting off as a new nurse and not knowing anything, dealing with being new, feeling very inferior and almost having like an imposter syndrome versus feeling more identified with your title but not as comfortable accepting everything that comes with it. Both stages were like a lot. I really had to rely on strength to get me through. My first year is brutal. I wasn't able to have much of a social life as I wanted to. Switching between day and night shift was really hard in figuring out how to manage my life outside of work. Even when I was on day shift, depending on how my schedule was set up, like if I had to work days back to back, I would get off work at 7 p.m. and get home, eat, shower, maybe like check my phone, check in with people. By that time, I only have like 3 to 4 hours to do that before I had to go to sleep and wake back up super early the next day to do everything all over again. When you think about it, it's a lot of adjustment. You really have to get organized with yourself, with your space, with your time, and also intentional and disciplined about making the most of what you have. If you're just going with the flow, nursing will drag you through the mud. It's a really heavy responsibility to carry, but now we can talk about the stage that I feel like I'm in currently and all the benefits that come with being in this stage and being a nurse. Do y'all hear that? I am comfortable enough to be thrown in any situation, even if I've never experienced it before, and know how to safely take care of the patient, to accommodate family members with that. Just know how to get my work done efficiently. Like, I am good to go. I still just want to emphasize though that I never get too comfortable. I still leave some room for uncomfortability because I feel like when you're too comfortable, then you're not afraid. And you do have to be afraid of this stuff because you can make a mistake and that could risk literally somebody's life. So yes, I am very comfortable. Yes, I am very zen, even in the madness and chaos. But I am still just a little bit, I'm just cautious with what I do because I'm scared to make a mistake. But not to the point where it derails my mental health and my sense of well-being like it did in the beginning. I'm in that good place of being comfortable at work and also having a good balance outside of work. Even though I am on straight night shift, which is very unfortunate now, I plan on my days so that I can wake up and still enjoy my day on my off days. When I work, I make sure I'm still able to do things. I'm not just having all of my day go to work. If you guys want a video actually on how I spend my off days or I get ready for my night shift, then let me know. I'll record like a little night shift routine for y'all or something like that. If there are people on the internet who glamorize nursing, I feel like that's where I am. I honestly don't think that any like working job is to be glamorized because it's work at the end of the day. Let's start to get into the benefits now that we're talking about that actually. The schedule, even though you're working 3 12-hour shifts, I could be off on a random Tuesday, enjoying my day during the day, getting stuff done early while everyone else is at work, and that is such a great feeling. Once you aren't working like every other weekend and don't have certain requirements for your schedule, and you can just put yourself literally on whatever days you want. You could schedule yourself to work 3 days in the beginning of the week, 3 days at the end of some other week, and I could literally have a week plus off work without using any PTO. Something else I think that's a benefit of nursing is security of the job. We need nurses everywhere. I feel like that's just a known fact, and even if I'm not needed at my current job, I can have a job next day. There's many different fields that you could go into. Even if I didn't want to be an inpatient nurse, I could work outpatient, or I could work in a clinic, work many different places. Yeah, there's just so much security in nursing that I wouldn't trade for any other job, especially in this economy and everything that's going on right now. I know it's hard for a lot of people. Something else that I found that nursing helped me with is discipline. It's really what you make out of it. I feel like nursing can definitely teach you how to be super organized, time efficient, and disciplined. Like the way that we wear so many different hats in the hospital and we do so many tasks in 12 hours, make so many decisions. I'm joking when I say this. If there was any other time in my life where I would experience something that's close to ADHD, it would be this. The way that I have to multitask and so many things done at once with nursing, I feel like it trickled over into my actual life. So now I'm able to get so many things done much more faster because I'm always multitasking. It could be a pro or it could be a con for you depending on how you like to live your life. Overall, it really does help your lifestyle. Another benefit to nursing, I would say, is there's respectability that comes with it. Most people are very appreciative of the work that nurses do, even though I feel like they don't know everything that goes into it. Only you knew. I have discounts here, here, and here because I'm really out here saving lives. Y'all playing around because y'all other perks to other people. They ain't doing the half. They saving somebody's life? No, they're just putting in numbers and reading emails. Nurses deserve so much more respect, so much more money. I'll get into the pay, just give me a second. But let me finish this respectability point. So yes, we do get a lot of respect. They'll ask me, oh, what do you do for work? And once I tell them I'm a nurse, they're like, how can I help you? Like, they really do treat you differently. So it's so interesting to see that, like, to just see that. It's really interesting. At the end of the day, we do deserve more respect. I like the appreciation and the kind remarks, but I need something tangible, you know? I can actually see how what I do affects people and their lives. That is very rewarding. I do treasure those moments for sure. Like when family members tell me how therefore they feel like they are and their babies are under me. I'm like, are you sure that I did that? Like, even it's just a simple thing of like making them more comfortable, even being able to see them grow and eventually get discharged home. Like that just does something for me. In that aspect, I really do love nursing because it is rewarding. Let's get into the pay now. Like, that's what everyone would like to know. When I first started out as a new grad nurse, my first nursing job, I was making $34 an hour. Calculate that, 34 hours times 12 hours per shift times 3 times a week. I was making about $2,000 take home bi-weekly. That's after taxes and all those deductions. Is nursing really a luxurious lifestyle? At first, no. I'm gonna be honest with you guys, it's not. If you're thinking that you're about to be purchasing a Birkin bag, Gucci, Louis, Fendi, Prada, this is not that. You're gonna be okay. You're gonna be making a decent amount of money, but definitely not luxury. Like, this is not a luxury job. For me though, personally, it really helped me to get stable and to get some grounding, especially starting off from college. But I know that there's other fields that pay way more and you have to do less work. Your pay increases every year that you have experience, and if you like do certain stuff on your unit, and they have differentials that come with that. And then also for me working night shift, I do get differential for that as well. So it can increase over time. I think that if you are smart with your money and know how to save it and also invest it, investing is very important. If you do those two things, and I definitely do think that nursing can provide you with a luxurious lifestyle. It does not equate to it, but you can make that out of what nursing gives you. That's a benefit, but then also a con, because there's many ways that you can increase your pay as a nurse. That's a great benefit, but also a con is we are overworked and underpaid. As a new nurse, only making $34 an hour, that's underpaid, especially for the work that we do. So many micro decisions you have to make, so many tasks you have to handle, so many emotional feelings and things that you have to navigate personally with your patient, with your patient's family, with your coworkers. It is a lot. Another con to nursing is the overwork part. You're working full time, you're working those 12-hour shifts, those are long shifts. You literally go to work the morning or the night, you're working all day, your whole day is gone. When I first started working night shift, after giving a report to one of the day shift nurses, they were like, okay, see you tonight. I was like, tonight? And it's like, yeah, you're back in the hospital the same night. You leave in the morning, you're coming back that night. Really put that into perspective, y'all. That is crazy. Like the system, hospital system and how they treat nurses is just not it. You're understaffed and your unit just has to pick up the work like nothing else is done. And I feel like the system overall just really doesn't care about nurses. Like it just treats us like we're disposable, which we're not. Many things that goes into that. I first started out as a nurse, my schedule, how bad it was for me and trying to balance my life outside of work. It can be really hard, especially when you're working night shift. You're working like every other weekend. You know, you want to go out with your friends. You want to spend time with family. You have to miss some things because you have to work that night or you have to work that weekend. You can't find a switch, so you have to miss a holiday. And remember that nursing, 24-hour job, the hospital is open 24/7. You don't get a summer break, working around the clock all the time. That is hard thing to do. So if we're thinking about if I would recommend nursing, honestly, I would probably give it like an 8.5 out of 10. Even though it comes with a lot of responsibility, it comes with a lot of demand of your time, I still recommend nursing. It is such a respectable field. I do feel like the work is very meaningful, at least for me. I really do enjoy what I do. I also enjoy the life that it allows me to live outside of it, even though there is definitely its cons. Once you get past all of the issues that comes with it, it definitely gets better and more manageable. I just had to update you all and let you know how my first year of nursing went. It was definitely rough, hard, emotionally taxing. It was a year, but we pushed through. Just thank God for that. If you guys want to see me do more videos on nursing, definitely let me know and I can start recording those for you. I'm in a really good place where I feel super comfortable, can actually have time to do those kind of things. During that first year, I was like, I don't have time for nothing. All I have time for is to catch up on the sleep that I'm not getting when I'm having to wake up for these shifts. Now that that whole year of adjusting to nursing is over with, we have more time to give to other things and I'm so excited to do that. That is all I have for you. I will see you guys in my next one.